Hello everyone, myself Jannat Hussain Khan, and today we are going to talk about the neurophysiological facilitation of the respiration. This is as six types. In six types, first is our perioral stimulation, and second is our thoracic vertebral pressure, and third is anterior stretch lift of the posterior basal area, and fourth is intercostal stretch, and fifth our co-contraction of the abdominal pressure, and third is moderate manual pressure. First, we are going to talk about the why. What is the use of neurophysiological facilitation of the respiration? The NPF is used for the patient who is on ventilator and who is unconscious and who is a non-alert patient. Those patients we are applying the NPF technique. Now we are going to learn how to perform perioral stimulation. In perioral stimulation, we have to put our finger on the patient's lip and nose in between, and we have to tell patient inhale by the nose and exhale by the mouth. This will help to patient for the deep breathing. Open mouth, O saved. Now, second, we are going to talk about the thoracic vertebral pressure. In thoracic vertebral pressure, there's two types, T2 to T4, and second is our T7 to T9. In that, we have to talk about person to sit or lie down. We can do also. We have to put our hand to. This is our T4 to T2 to T4. We have to put hands like this and tell patient to lie down. And during the inspiration, we have to put our hand like this, and during exhalation, we have to press our hand to downwards. Inspire and exhalation, we have to put our hands downward. And second is sit up. We have to put our hands on T7 and T9. In that, patient has to inhale, and during exhalation we have to put our hands downwards like this. This is our second type. And third, we are going to talk about the anterior stretch of the posterior basal area. In that, we have to tell patient put our hand on back on both side, and therapist has to put hand on the lower abdomen like this. And during inspiration, we have to move upward. During exhalation, downward we have to press. We have to inward and upward like this. Like this. And fourth, we are going to talk about the intercostal stretch. In intercostal stretch, therapist is lie down, and we have to put our two fingers on between of the two ribs. Like this, we have to put our fingers, and we have to tell patient inspiration, inhale, and during exhalation, we have to put our fingers downwards like this. And step by step for all intercostals we have to do. In between the ribs we have to put our fingers. This can be used unilateral and bilateral also. And now we are going to our fifth one is our co-contraction of the abdominal pressure. In co-contraction of the abdominal pressure, we have to tell patient put up hands on back, and one hand we have to put on ASIS, and second is lower abdomen. And during inspiration we have to assist, and during expiration we have to inward and upward we have to put our hands. Inhale, and during exhalation we have to put like this. There is triangle shape should become this one. Now last one we are going to talk about, the last one, is moderate manual pressure. In moderate manual pressure, patient position is supine line, sorry, side line, and we have to put one pillow in between the legs like this. Patient has to be in side line, and we have to put our hands on the of the ASIS, and we have to press during exhalation. We have to gently press. We don't have to give more pressure here. This is all about our neurophysiological facilitation of the respiration. These are 6 techniques we have learned in this video. Thank you so much.